Okay, so I'm going to talk to you guys today about bedside report and how it improves patient care. The change of shift, as we all know, is a time whenever we transfer patient information to the oncoming shift, and effective communication is critical to ensure patient care during this time. Bedside shift reports, it improves patient safety, increases patient participation and satisfaction. It enhances nursing teamwork and accountability, and improves the efficiency of communication among the healthcare staff. In 2010, there was an estimated 180,000 preventable patient deaths. Now there's between 210,000 and 440,000 preventable harm, and that results in patient deaths. Bedside reporting goals is to improve the patient safety and allow patients to have a better understanding of their condition and treatment plan. And it encourages patients to be active in their care, which happens to also be a safety goal of the Joint Commission on Accreditation of Healthcare Organizations. During shift change, patients are able to receive information about their own care, speak up about any concerns, or ask questions that they may have. Patients who receive bedside reporting are more compliant with treatments and have better health outcomes. The nurses are able to visualize the patient in a short amount of time during change of shift. And events are more likely to happen during the low time in traditional change of shift reporting. The goal of the nurse bedside shift report strategy is to help ensure the safe handoff of care between nurses by involving the patient and their family. Some literature review, some research studies that I was able to find was one, there was 60 patients that were surveyed, 30 before and 30 after the use of bedside reporting. Patients were given self-designed surveys before and after the change, and there was statistical improvements that achieved with patient satisfaction and involvement in their care. Increase in staff accountability and patient satisfaction also increased. There was another one with the Metro Health Medical Center in Ohio. The goal was patient satisfaction, and it raised to 98% after the use of bedside report. Nurses reported to be more aware of patient issues and were able to prioritize their work more efficiently. Another research study was done in a medical surgical unit, and it was to monitor nurse-patient relationships and patient satisfaction. And interpersonal relationship therapy was used based on the idea that the nurse-patient relationship is therapeutic and crucial for nurses to assess, plan, and put context behind their care delivered to their patients. Surveys were taken after the patient discharge, and the satisfaction raised from 75% to 87.5%. Another study was done at Midwestern Academic Health Center, and they had an average patient census of 16.8. The study lasted from February 2009 to May 2011. Patients answered specific satisfaction questions, and nurses compared pre and post use of bedside report. 44% of the nurses said that they were able to see an improvement in patient safety and involvement. 72% of the patients were satisfied, 72% were very satisfied, 26% were satisfied, and 3% were dissatisfied. In a large hospital, a medical surgical unit, surveys were given to monitor patient satisfaction, nursing satisfaction, patient falls, nursing overtime hours, and medication errors. The statistics reported that patient safety did improve, patient falls decreased, patient and nurse satisfaction improved, and medication errors were reduced. And overall, the patient satisfaction and nurse accountability did increase. So my PICO question was aimed towards the research to focus primarily on patient safety along with patient satisfaction. Hospitalized patients are the targeted population. The main intervention is to utilize bedside report during shift change. Research project will compare the bedside reporting to privately given report. The anticipated outcome will be increased patient safety, including decreased medication errors and falls, and increased patient satisfaction and participation. Theoretical clinical framework. King's theory of goal attainment focuses on patients' health goals through nurse-patient relationships. According to King, the patient and nurse first communicate and set goals, then together they achieve those goals. Using nursing process to help describe the interaction between the nurse and the patient. Communication is a major concept within this theory, and the theory of goal attainment describes nursing as a collaboration of nurses and patients communicating information about the situation in order to set goals, determine the resources available, and then accomplish those goals. The theory of goal attainment is applicable to bedside reporting. Nurse-patient interactions are significant to ensure the goals. According to King, the environment is the background for interaction, and nurses are a part of the patient's environment. When using King's theory during a bedside shift report, it's not only improving the quality of patient care and satisfaction, but it's building the nurse-patient relationship. Design, setting, and sample. The research project will be conducted as a quantitative experimental study. Bedside reporting will be compared to privately given report in a hospital setting. Study will focus on comparing the overall safety of the patient. Results will be interpreted to determine if bedside reporting increases the safety and satisfaction. The research study will take place for approximately 3 months. The study will be divided into consenting control groups and experimental groups of patients. Control groups will be the patients who do not receive bedside report, and the experimental group will be the patients who do receive the report. The study is based on approximately 100 patients, but this may vary depending on the hospital census and the patients who are willing to consent. Criteria on choosing the sample will be fairly simple. All patients who are admitted to the hospital will take place in this study. Every patient will be observed throughout their stay for safety. Satisfaction will be rated by every patient at the end of their stay. Patients will be asked to sign a consent form. The patient's rights and confidentiality will be protected during this experiment, including their responses and their feedback. Patient names will not be required on the survey, only the date of their hospital stay. Data for this project will be collected before and after the use of bedside report to provide feedback related to the hospital stay and the patient satisfaction. The means of collecting the data will be through surveys given at the end of their stay or after discharge. Surveys may be conducted through face-to-face interview, telephone interviews, paper questionnaires, or online questionnaires. The format would be a numbered scale labeled 1 through 5, with 1 being highly dissatisfied and 5 being highly satisfied. The questions include involvement in care, understanding the condition and treatment plan, patient teaching, nurse-to-nurse communication, nurse-to-patient communication, friendliness, and overall satisfaction. The nurses will be given a test also to provide feedback regarding the accountability, teamwork, prioritizing patient care, and communication. Hospital will keep record of patient falls, medication errors, and any preventable harm or death. The data analysis must be used to keep results accurate and organized. In order to accomplish this, software and formulas must be used. The statistical package for social sciences, SPSS, is a software that will be used to record and calculate the data. SPSS is a user-friendly application that uses Microsoft technology, and so this will decrease time and improve accuracy. T-test and ANOVA will be used as the formulas to help analyze the data received. T-tests are used to compare the means from the 2 different patient groups being surveyed, and ANOVA, which is analysis of variance, can be used to compare the patient surveys with the nurse surveys. The formulas will be used pre and post use of the bedside reporting in order to compare responses using averages and percentages. And then the results will be computed onto graphs and tables, and this will make it easier to read and see the reflection of the impact of the reporting, bedside reporting. So in conclusion, bedside reporting stands to be one of the more effective and safer ways to hand off information during shift change. It drastically decreases patient harm and death, not only affects the patient safety but overall care. It increases